This video is going to cover how to treat an anterior sacrum or a bilateral flexion. So the dysfunction is like this. On normal inspiration, your sacrum wants to go back. On normal expiration, your sacrum wants to rock forward. So we are going to use that and treat with respiratory force. So since hers is anterior like this, we are going to move with the inhalation, and then on exhalation, we're going to resist it going back forward. So I'm going to place my hand on her ILAs and place my other hand on top. And so when she takes a deep breath in, I'm going to follow them back this way. And when she breathes out, I'm going to resist the sacrum wanting to rock back forward. Breathe in again. I'm going to follow it down this way. And on exhalation, I'm going to resist the sacrum moving back up that way. This video covers using respiratory force to treat a posterior sacral base or a bilateral extension. So the sacrum would be like this. So on normal inhalation, the sacrum goes back into extension. On exhalation, the sacrum rocks forward into flexion. And so since it's like this, on inhalation, we are going to resist here, and then on exhalation, we're going to follow it down. On inhalation, resist the normal movement backwards, and on exhalation, follow it down to pick up the slack. So this hand is going to be on the base and my other hand is going to be on top. So I'm going to have the patient take a deep breath in and resist on this hand. And then on exhalation, I'm going to follow the sacrum down this way. On inhalation, I'm going to resist up here. And then on exhalation, follow the sacrum back down this way. This is another way to treat an anterior sacrum or a bilateral flexion. This is going to be using muscle energy. So the typical position for this is to have the patient flex legs up and come around and reach the sacrum. However, my arms are not long enough to do that. So a modified position for this is to have the patient lay on their side with their knees towards you. You're still going to flex them up. You're going to put their knees onto your legs. You're going to monitor their sacrum, and you're going to have them push against you for 3 to 5 seconds. Relax, take up the slack, have them push against you for 3 to 5 seconds again, and relax. This video is going to cover how to use muscle energy to treat an anterior torsion. Specifically, this patient has a left on left torsion. So we are going to need to rotate the patient left and side bend them left. So the first thing I'm going to do is monitor the segment. I'm going to rotate them left, so go ahead and grab my elbow and rotate until I feel it in the L5 segment. Then going to worry about side bending, so I'm going to flex her hips up until I feel it in that segment. I'm going to still monitor the L5, and I'm going to lift her hips up, which is going to induce a left side bending. I'm going to have her push her feet into my right hand for 3 to 5 seconds. Relax. Pick up the slack to the new barrier, have her push against me again. Relax, pick up the slack, and do it one more time. Relax. And then I'm gonna return her to neutral position and then recheck. You can do the same thing for an anterior torsion, right on right. You would just do it on the opposite side. This video is going to cover how to use muscle energy to treat a posterior torsion. And so this patient, it has a posterior torsion that is left on right. And so I'm going to need to rotate her left and side bend her right. So to start, I'm going to find the L5 segment and monitor that as I rotate her left. Only rotate her until I feel it in the segment. And then I'm going to switch hands so that I can get her into a right side bending. I'm going to flex her knees up until I feel it in the L5 segment. Then I'm going to drop her top leg off the table to side bend her right. So that means that this is coming down and that is going down to side bend her right. I'm going to place this hand on her knee, and I'm going to have her push her knee into my hand for 3 to 5 seconds. Relax. I'm going to pick up the slack, have her push against me again. Relax. Pick up the slack and do it one more time. relax. And I'm gonna replace her to neutral and recheck the segment. You can do the same thing for a posterior torsion that is right on left. The patient would just be lying on their opposite side.